There is a powerful therapy for cardiovascular disease that will save your life. It's called EECP, or Enhanced External Counterpulsation.
It's kind of like a natural bypass.
The results are great.
It literally saved my life.
EECP is FDA approved. You simply lie on a comfortable bed. 3 blood pressure cuffs are placed around your calves, thighs, and buttocks. When your heart is at rest, the cuffs pump oxygenated blood from legs up to the heart. This opens new arteries and it improves total cardiovascular function.
Number 1 cause of death in the United States is heart disease. The number 2 cause of death in the United States is cancer, and number 3 is stroke. When you take number 1 and number 3, we are dying due to blockages in our arteries.
I'm Dr. Franklin Murphy, board certified in internal medicine and cardiology, clinical professor of medicine at UCLA. We have a variety of ways to treat coronary artery disease. We can give patients medications, we can do angioplasty, we can do bypass surgery, and now we have EECP. EECP, however, stimulates the growth of new blood vessels to go around the blockages and or the widening of these new vessels, which are already naturally beginning to occur as part of the normal mechanisms of the human body.
My name is Dr. Ronald Weaver. I'm an internal medicine specialist. Enhanced external counterpulsation. It is a remarkable treatment that is non-invasive with no side effects, that is very effective in the treatment of patients with cardiovascular disorders.
As you see, by this squeezing action, delivering massive amounts of blood flow to the coronary arteries and the heart, the patients actually develop new blood vessels to go around the blockages. It's kind of like a natural bypass. It's a bypass without using the surgery. It's angioplasty without having to go in and dilate the arteries. It's a much less invasive, kinder form of treatment that we have. It just so happens that EECP provides us yet another tool to treat people who do have coronary artery disease.
By using the cardiolight machine, we're actually able to see if the patient's heart has improved. Don Murphy had come here, he had 2 blocked arteries. When we put him on the cardiolight machine, we actually saw a large area of his heart that was not getting enough blood. That's why he needed bypass surgery or EECP. By doing 1 hour a day, 5 days a week for 35 treatments, we then did another cardiolight to see how his heart had improved from before EECP to after EECP. After we took that cardiolight, we saw that not only did his open up new arteries, but we actually saw his heart muscle improved. From the beginning of his EECP treatments till the end of his EECP treatments, his heart had turned out to be 100% improved with getting blood up to the heart muscle, and lots of collaterals, which are new arteries, were all over his heart.
I was experiencing extreme chest pain. I went to the hospital. They immediately took me into the operation room and put in 2 stents. A week to 2 weeks later, I was experiencing even more chest pain. Took me back to the hospital and they wanted to take those stents out but couldn't get them out, and they had to put in 2 other ones. Those stents didn't really work either. 2 weeks after that, they wanted to do, bypass surgery. And my minister, Reverend Michael Beckwith, was telling me about global cardio care, and he insisted that I come and meet Sarah and her staff. And we started the procedure of the treatment here.
It is 100% safe, it's FDA approved, there's no medication, there's no surgery. You simply lay down in a very comfortable bed. There are 3 blood pressure cuffs that are wrapped around your calves, your thighs, and your buttocks. At this time, we have you timed to the heartbeat with an EKG. So during the time when your heart is at rest, these blood pressure cuffs start to squeeze the blood from your lower extremities and pump it throughout the whole entire body. For the first time, your heart gets to rest, but internally you're getting this massive passive cardiovascular workout, and for the first time your blood pressure, your heart rate drops without you having to do anything but simply lay down and take a rest.
To this date, I haven't had the bypass surgery. I've continued my treatment here. I'm feeling great. I don't experience the pain in my chest or the numbness in my arm. I'm back exercising, walking mountains, and feeling 100% better. They literally saved my life.
Eecp does a number of dramatic things to the human body. We've seen it be very effective in treating diabetes, Parkinson's, high blood pressure, stroke, and again, just a whole constellation of various illnesses.
In my patients who have gone through Global Cardio Care EECP treatments, they've had various medical problems. Not all have had strokes or cardiovascular conditions, but I've had patients who had diabetes, which we also know is a risk factor for coronary heart disease as well as peripheral vascular disease. They have reduced therapy needs for insulin or oral agents if they are taking that for the control of their diabetes mellitus. It's my understanding that that occurs as a result of the increased blood supply that you see, also the weight loss that you see in these individuals who complete the course of EECP.
There are risk factors that we can change, such as high blood pressure, high cholesterol, diabetes, obesity, and stress. These are things that we can improve for a better health.
I had a lot of severe pain in the chest and some difficulty in breathing. And so I would try anything, especially I was interested in alternative, because for me to go into a surgery type thing didn't attract me. And so I felt this was the answer, and I found it to be so. They increase the blood flow to the entire body. It's great not only for people that have heart conditions or preventive heart conditions, it's great for any type of condition that I can think of, because it makes sense. The flow of blood is the key to good life, and that's it.
100% of the people feel better once they get the treatment. And we find that with this improved feeling better, they seem to be able to exercise more, to enjoy life more.
I now play tennis, I play paddle tennis, I go to exercise classes, no lack of breath. I can breathe. People are amazed. They look at me and they say, wait a minute, you got the energy of a 16-year-old, and I do.
My name is Don Murphy. I'm 57 years old.
So my name is Buddy Collette. I'm 84 years old.
My name's Al Weber. I'm 91 years young, not old.
EECP for the last 11 years has been successful in treating people with cardiovascular disease.
It's a very comfortable place to come to. It's wonderful. You feel comfortable. The treatments are wonderful. The results are great.